Here tonight, we're learning more about more than a half dozen overdose deaths in Erie County yesterday. It happened in just a 6-hour time frame. The deaths occurring in Buffalo, the town of Tonawanda, and Lackawanna. The county says 7 people in all died, and while toxicology tests aren't done yet, it appears that all of these scenes included some form of powder or crack cocaine, likely laced with something deadly like fentanyl, although still waiting for specifics. Ages ranged from the early 40s to early 60s. 6 of the victims were men, 1 was a woman. Ann Bobak is director of the medication-assisted treatment program at Spectrum Health and Human Services, and Ann joins me now live. I really appreciate you coming in, Ann. Good to see you again.
Very exciting, but the only thing that's going
Okay, so these, I think we got the wrong mic on there, just to let the director know. These numbers are obviously so troubling, right? When you hear 7 people losing their lives in such a short period of time. What is just your reaction to that, and folks in the community, those of you who deal with this every day?
Well, you know, it was kind of a surprise, so many all at once, but I think typically there's at least 1 person dying of an overdose every day in Erie County. You know, it wasn't also surprising the ages or that things were typically mixed with, associated with cocaine use, because that is typically what the overdose deaths look like. You know, an older population, cocaine associated with like fentanyl use.
Some people were wondering about comments from Erie County Executive Mark Poloncarz yesterday that said Narcan in these cases, or at least some of these cases, may not have been enough to save their lives. Walk me through what that means and why that might be the case.
Well, you know, I think maybe at that point he was not sure what was causing the overdose, so probably wasn't aware it was fentanyl. We don't even know if it was fentanyl, but typically maybe the potency of this, people need more than 1 or 2 doses. I saw, you know, a few comments. I think Cheryl Moore,
with the county,
she had said, you know, sometimes people need 4 doses or more. So maybe that's kind of what he was thinking.
Does this give us an indication that there is some particularly bad batch of drugs out there? Do we think that there's some connection between these 7 cases? Because to have 7 in such a short period of time is
I would think there's some bad drugs out there. I would think they're connected, but I don't know for sure. I guess they have to wait till more data comes in, but yeah, people need to be very careful because something's out there and it's killing people, and to have 6, you know, in one day, like I think within hours, is a big deal.
Yeah. Finally, I want you to give the message to the public, though, even though Narcan isn't 100% effective. For instance, it works with opioid overdoses, right? It won't necessarily work with some other tainted drugs. But how important is it that everyone keep Narcan in your car, keep it in your purse if you can, because you never know when you might be able to save somebody's life.
Right, absolutely. And most of the substances that people use that they didn't get from the pharmacy do seem to be laced with fentanyl. So it's good to have it. It's good to know how to use it. You know, if you don't know how to use it, the instructions are on the box, and you can also go online and just see a video. But it's important. Everyone should have it, know how to use it, because you're going to save someone else. Yeah,
and the 7 lives that we lost yesterday just continue this trend of seeing more and more of these. I mean, we're on pace for just horrific numbers for this year.
Yeah, I think between the confirmed and suspected overdose, it's almost like 200 opiate-related deaths this year, so it's only June.
We're not even halfway through the year.
Right.
Well, Ann Bobak is director of the medication-assisted treatment program at Spectrum Health and Human Services. I hate that when we talk, it's usually about these awful circumstances, but thank you for coming in.
Okay.
And good to see you.
Yep.